Welcome to Baylor Scott & White Medical Center Trophy Club. We have created this joint wellness program for you and your family to assist in informing everyone on the process of preparing for your surgery, your stay here in the hospital, and preparing you for discharge home. Baylor Scott & White Medical Center and Trophy Club is certified by the Joint Commission for hip and knee replacements. Prior to your procedure, there are some preparations you will need to make. Make a list of questions you may have. Also, any appointments that you may have, and gather your medication lists. We will ask for this information during your pre-admission appointment. Also, be sure to gather your physician's phone numbers, especially your primary care physician and other physicians you see on a regular basis. For example, your cardiologist or your pain management physician. Begin thinking about what your plan is once you discharge home from the hospital. It is recommended that you have a friend or family member stay with you for the first 2 to 3 days. Once you arrive home from the hospital, a case manager will be meeting with you throughout your stay to assist you and your family with discharge planning needs. We encourage you to have a joint coach. The joint coach could be a family member or friend who will be with you throughout your recovery process. We encourage you to invite your joint coach to the hospital throughout your stay. They can also be there to assist you with discharging home and your therapy sessions. Please arrange for someone to be with you for at least the first few days after discharge. You will need the help. You will be sent home with a walker and will not be able to carry items such as food and drinks while walking with your walker. The joint coach can also assist with any activities of daily living, like obtaining your food, drinks, and basic necessities. They can also help with any transportation needs. It is important to start with the following exercises before surgery to make your recovery easier. Ankle pumps can be done while laying flat in bed or in a recliner. Move your ankles towards then away from your body. Quadricep sets can be done in a bed or in a recliner. Tighten the muscles on the top of your thighs by pushing the back of your knees down into the bed. Hold for 5 to 10 seconds, then relax. Glute squeezes can be done while laying in bed or in a recliner. Tighten your buttock muscles together, hold for 5 to 10 seconds, and then relax. Chair push-ups can be done in any chair with armrests that doesn't roll. Place your hands on the armrests and push up your body by straightening out your arms and then sitting back down. Perform the exercises 15 to 20 times each, 3 times a day. Prior to your surgery, you will either go to your primary care physician for testing or come into the hospital for testing. If you will be coming in for testing, we will be testing your labs, performing an EKG if needed, and take x-rays. You will also be meeting with your nurse to go over your medical history. Be sure to bring that list of physicians and their phone numbers along with a list of medications that you're currently taking with the strengths and doses. If you do not come to the hospital for your testing, we will be calling you within 1 week of your scheduled surgery date to review your medical record, obtain your physician phone numbers, and review any of your medications that you're currently taking. You will need to be tested for COVID prior to your surgery. The hospital will be contacting you within 1 week of your surgery to let you know when you need to come in for your COVID test. Once you have had your COVID test, the hospital requests that you quarantine prior to surgery. If your test comes back positive, you will receive a phone call from our facility. We encourage all of our patients to stop smoking prior to their total joint replacement. By not smoking during your recovery, you can improve the healing of your new joint. Those patients who do smoke have a higher risk of complications such as blood clots, low blood count, heart problems, and kidney failure. Studies show patients who smoked throughout their recovery had a 10% failure rate versus those who did not smoke. When preparing for your hospital stay, be sure to pack a bag and bring the following: a few change of clothes. We recommend loose-fitting clothes. We also recommend you bringing a pair of socks and walking shoes to wear the day you discharge home. You'll need to bring your basic toiletry needs, for example, your toothbrush, toothpaste, and hairbrush, as well as any equipment you may need while you're here, such as your CPAP or BiPAP, and your walker if you already have one. Please only bring medications that you were instructed to bring by your pre-admission nurse in the original bottles. Please do not bring in any narcotics, vitamins, herbs, or over-the-counter medications. Your medications will be sent to the pharmacy for verification, so it is important to bring your pills in their original bottles. We encourage you to set up a recovery station on the ground floor of your home. This recovery station should contain items such as reading materials, your phone, any electronics you may want, access to a charging station, and the TV remote. It is also a good idea for you to have extra pillows close by. Prepare some meals in advance prior to your replacement to allow for easy access to food. You will not be able to cook for yourself over the next few weeks. Measure your bed height and bring that number with you into the hospital. Therapy will be able to adjust your bed in the hospital to the correct height so you can practice bed transfers before you go home. Be sure you have a firm chair with armrests that does not roll. You will need help for the first few days once you discharge home from the hospital, so be sure you arrange to have someone stay with you for the first few days, especially if you live alone. Be sure to remove all loose rugs, cords, and clutter from pathways to allow you to walk freely with a rolling walker once you discharge home. When there is too much clutter, a walker may not be able to fit through and could cause you to fall. Be sure to keep items off the floor and clear pathways for your walker to fit through. Before you return home, have loved ones go in and secure your pets. Most pets are excited to see their owners and may accidentally cause you to fall. Have someone secure your pet prior to you entering the home to allow for a safe transition into your home. Once you are seated, the pets can come out to see you. The night before your surgery, be sure to pack your car with your overnight bag and shower with HibaCleanse. HibaCleanse is an antibacterial soap that you will need to shower with for 3 days leading up to your surgery. You will want to wash your body, concentrating on the surgical area and avoiding your face and genital areas. This soap will be given to you when you come in for your COVID testing. Be sure also to stop eating and drinking before midnight or the specific time in which your anesthesiologist stated. Some surgeons allow you to have up to 12 ounces of clear liquid 4 hours before arriving to the hospital. Your pre-admission testing nurse will notify you if you are allowed to drink before surgery. And as always, the anesthesiologist has the final say. The day has come. It's time for your surgery. Review your instructions for the day of surgery and remember no eating or drinking on the day of surgery unless you are instructed to do so. You may check your blood sugar in the morning, but we will also be checking your blood sugar once you arrive to the hospital if you're a diabetic. If you were asked to bring in medications, be sure they are in the original bottles and that you have all of your equipment and personal items. Also, remember to bring your mask. Encourage your family members to bring a sweater or a jacket and their masks. It can get cold in the hospital. Be sure to arrive to the hospital on time. You will be entering the hospital through the emergency room entrance. Here you will be greeted by security who will be screening you and your family member for COVID before entering the hospital. All patients and family members must wear their masks at all times when in the presence of a hospital staff member. Once you have been screened, you will check in with the receptionist with a photo ID and your insurance card. Bring in your medications and CPAP or BiPAP at this time. Your other personal belongings and walker can be brought to your room later by your family members. Remember, do not bring in your narcotics, vitamins, herbs, or over-the-counter medications. Your family will be updated on your status by phone or text, so be sure your family member has their phone turned on and is close by. And please remember not to bring in any valuables into the hospital. You will receive some forms during admissions. One of those forms is our patient goal form. It is very important to us here at Baylor Scott & White Medical Center at Trophy Club to know what your goal is for having this surgery and how we can provide excellent care for you throughout your stay. Please take the time to fill out these forms and your pre-op nurse will be collecting them from you. Once the pre-op nurse is ready for you, they will call you back. They will be checking your armband and giving you items to change into. A physical assessment will be performed here and your surgical site will be identified and prepped. Your IV will also be started here. We do have access to vein finders and numbing medication to make the start of your IV as painless as possible. You may have blood work drawn at this time, and an antibiotic will be started to reduce the risk of infection. You may also be receiving IV and oral pre-op medications at this time. You will get a chance to meet with your physician one last time before surgery and the anesthesiologist. A family member may also wait with you in the pre-op waiting area if you would like until it's time for your surgery. To allow for proper social distancing, once the OR team takes you to the operating room, your family will need to exit the building. Your family may choose to wait in their car at a local coffee shop, a restaurant, or at home until your surgery is complete. We will continue to update your family on your progress by phone or text, and as a reminder, both you and your family must wear their mask at all times in the presence of a hospital staff member. You will receive a box of Nosin in pre-op. Many individuals carry germs in their nose. If these germs make it from your nose to your incision site, it could cause an infection. As a way to prevent infection from occurring, we begin Nosin prior to surgery in pre-op and have you continue applying every 12 hours over the next 5 to 7 days. Nosin is a nasal antiseptic made from alcohol and essential oils. It's like a hand sanitizer for your nose. Finally, before your procedure begins, you will be involved in a timeout. During this timeout, you will be asked what surgery you are having and which leg. Each member of your surgical team will verify and your surgeon will mark the correct site. Once the timeout is complete, you will head off to the surgical suite. You may or may not remember the trip to the surgical suite. If you are awake, you will see a sterile suite with bright lights and people in gowns and masks. They will have you assist in getting onto the surgical table, and then the anesthesiologist will put you to sleep. When your surgery is over, you will wake in the recovery room. They will be monitoring your vital signs frequently, and they will take an x-ray. Your family will be notified that you made it to the recovery room. Your family will get a chance to talk to your surgeon, so remind your family to have their phone on and close by. You will stay in the recovery room for about 1 to 2 hours, and unfortunately, your family will not be allowed back in the recovery room. After the 1 to 2 hours you spend in recovery, you will be reunited with your family in your room on the post-surgical unit. When you wake in the recovery room, you may have some of these items attached to you. An oxygen tube in your nose to assist with breathing, and an oxygen monitor will be attached to your finger. TED hose will be placed on if your surgeon orders to assist with blood clot prevention. An on-cue ball is a ball with medication that will be placed at or near the incision site to assist with pain control if your physician orders. And you may have a drain to drain any excess blood coming from your joint. Air pumps may be placed on your legs to prevent blood clots, and if you have a hip replacement, you may have a hip abduction pillow strapped to your legs when you wake up to prevent your legs from crossing. Ice is an important part of recovery. Some physicians order cold therapy units. If your physician did not order a cold therapy unit, we will have ice packs to place on your surgical site. It is also a good idea to obtain some gel packs prior to your surgery to have available for you once you discharge home. Once you are ready, you will be transferred to the post-surgical unit where you will be reunited with your family. Your nurse for the day, a respiratory therapist, and a patient care tech will come into your room to get you settled. Within 4 hours of arrival to the floor, you will be getting up with either a physical therapist or the nursing staff, depending on your arrival time to the floor. You will be attempting to get up and walk on the new joint the same day. 95% of all of our hip and knee patients walk at least 10 feet the day of surgery. Studies show early walking prevents blood clots and pneumonia. To allow for safe social distancing, your family is unfortunately unable to join you on walks when you walk in the hall with the hospital staff. You will continue to receive 3 rounds of antibiotics to prevent infection, and an internal medicine physician may be consulted to follow your care throughout your stay. Your surgeon may consult an internal medicine physician to monitor you throughout your stay. The internal medicine physician will be monitoring your pain, labs, and addressing any medical issues that may arise throughout your stay. You will need to be cleared by both your surgeon and internal medicine physician prior to discharging home. Respiratory therapists will begin instructing you on the use of your incentive spirometer. It is very important to use this 10 times every hour. The incentive spirometer will assist in opening up your lungs and getting out any fluid that may have collected during surgery. This will assist in preventing pneumonia after surgery. Respiratory therapists will continue to make rounds on you throughout your stay during the day and night. Each room will have a communications board. This board keeps you informed on who your nurse, tech, physical therapist, and physicians are. The board will be updated at least every shift or when new staff come on to take care of you. Also on this board is your goal that you told us in pre-op, along with any daily goals that you're trying to meet. Finally, your medications that are due next will be up on the board so everyone can stay on top of your pain. Hand hygiene is very important to us here at the hospital. Hand hygiene can be performed by washing hands or using alcohol. Everyone should be using hand hygiene. This includes doctors, nurses, techs, therapists, dietary, and family members. If we forget, please feel free to remind us. Hand hygiene is the best way to prevent infection. Encourage your family members to also use the hand sanitizer stations throughout the hospital. To limit exposure and to allow for proper social distancing, your visitor must remain in your room at all times unless they are leaving the building. Your visitor will need to enter the building through the emergency room entrance and will need to be screened for COVID by our security before entering the building. Meals will be provided for your visitor throughout their stay, and both the patient and visitor will need to wear their masks when in the presence of a hospital staff member. Managing your pain is very important to us. Although you will have some pain after surgery, your nurses, surgeon, and internal medicine physician will work with you to control your pain so you can participate in physical therapy. We have multiple options to control your pain, such as applying ice to the surgical site, repositioning the joint, and medications that your surgeon and internal medicine physician can order. Those medications are IV medications that go directly into your IV, which typically stop after 24 hours, pain pills, anti-inflammatories, and, if ordered by your physician, an on-cue pain ball. If you are currently being seen by a pain management physician, be sure to let your surgeon and your nurses know prior to your procedure. Some disadvantages to pain medication include drowsiness, confusion, nausea, constipation, and itching. Your nurse and internal medicine physician will work to curb those side effects. Pain medication can drop your blood pressure or can cause you to not take a deep breath. If you are experiencing low blood pressure or having respiratory issues, it would not be safe to administer your pain medication at that time. We want your pain to be controlled after your joint replacement. Please do not wait until your pain gets up to a 7 or 8 before taking pain medication. When your pain gets out of control, it will be difficult to bring it back down. Sometimes it's difficult to give a number to your pain. Please refer to the faces on this slide as an example of how to classify your pain. A good pain level after surgery would be around a 2 or 4. Be sure to take your pain medicine prior to your physical therapy treatments. Your physical therapist will be working closely with your nurse to coordinate your pain medications so that you will be able to tolerate physical therapy. Surgery and medications can cause constipation, so it's essential that you drink a lot of water during your recovery in the hospital and also once you discharge home. Initially, you may notice a decrease in your appetite. As you continue to heal, your appetite will come back. Be sure to eat healthy proteins, fruits, and vegetables to promote healthy healing after your surgery. Your safety is very important to us. We will frequently ask you your name and date of birth to confirm we have the correct patient every time. Your hospital ID band will be scanned when you receive your medication to ensure we have the correct medication for the correct patient every time. We will be using hand hygiene throughout your stay to reduce the risk of infection, and we encourage you to do the same. We require both patients and family to wear their masks when a hospital staff member is present in their room or when you're walking in the hall. Anytime you get up and move around, a staff member will need to be with you. Staff will be placing a gait belt around your waist every time to reduce the risk of a fall. There will also be a fall risk sign above your bed and outside the door to notify staff that you are a fall risk. Fall prevention is very important to us, and we do not want you to fall. You have multiple lines and attachments that you are not used to having, plus you will be taking medication that you normally would not take on a regular occasion. For those reasons, we request that you do not get up by yourself or have family members help you without staff members being present. Surgery may cause blood to slow and clot in your veins, creating a deep vein thrombosis, or DVT. Some signs and symptoms of a DVT in the legs are swelling in the calf, thigh, or ankle that does not go down with elevation, and pain or tenderness in the calf. We do many things to prevent blood clots or DVTs from occurring. We encourage you to perform ankle pumps anytime while awake. You will be getting up and walking frequently. Also, while you're in the hospital, you will begin blood thinners, and your physician will also be sending you home with blood thinners for you to continue for a specific amount of days. Sequential compression devices, or SCDs, will be placed on your legs. SCDs are leg pumps placed on your calves that inflate and deflate. You will be wearing these anytime when you're in bed to prevent blood clots. As mentioned before, you will go home on a blood thinner to prevent DVTs or blood clots after surgery. Depending on your surgeon's preference and your past medical history, you will be discharging home with one of the following blood thinners: Lovenox, Xarelto, or aspirin. If your surgeon sends you home on Lovenox, which is an injectable medication, you and your family will be trained on how to administer the medication prior to discharging home. Prior to discharging home from the hospital, be sure to know which blood thinner you will be taking. Some signs of an infection are increased swelling, tenderness, warmth, and redness at the incision site, changes in color, amount of drainage, or odor of drainage, increased pain at the surgical site, and a fever greater than 101.5 degrees. If you have any of these symptoms, please contact your physician. The signs of an infection typically do not show up while you're in the hospital. When your surgeon or nurse changes your dressing for the first time, we encourage you to take a picture of your incision site to have a baseline image. Then, if a few weeks down the road you begin to display any of these symptoms, you will have an image to reflect back on to show your physician. As a reminder, it is best for you to quit smoking prior to your joint replacement surgery. The hospital is a non-smoking, non-vaping facility and does not allow vape or smokeless tobacco in the facility. As mentioned before, you will be evaluated by a physical therapist the day of your surgery. During this evaluation, we will develop a treatment plan that is specific to your needs, set goals for discharge, and communicate our findings with your physician. Your safety and fall prevention is very important to us. Depending on the type of nerve block you received, after your joint replacement, you may need to wear an immobilizer for the first day or so. The block your anesthesiologist gives you may be blocking the sensation and strength to the muscles in the top part of your thigh. If your physical therapist determines you are not stable enough to walk without an immobilizer, they will place one on your leg and place a pink must-wear immobilizer sign at the foot of your bed and the head of the bed. The sign will remind you and our staff that you must have an immobilizer on any time that you are up and walking around. With each physical therapy treatment, the therapist will be assessing your strength and sensation to the leg, and once your sensation and strength comes back, you will no longer need the immobilizer and the signs will be removed. Physical therapy has specific goals we would like you to meet prior to your discharge home. We would like you to get in and out of the bed independently, transfer into and out of a chair independently, walk at least 150 feet using a rolling walker, perform your home exercise program independently or with some assistance, and if needed, we have stairs we would like you to manage safely prior to discharging home. Physical therapy will be working with you twice a day and will perform activities with you in order for you to meet the goals and prepare you for discharge home. Your physical therapist will be working on breaking any bad habits that you may have picked up while walking. Your therapist will also be training you on how to walk correctly with your rolling walker. As a reminder to allow for social distancing, visitors are not able to walk with you in the halls during your therapy session. They will need to remain in your room. Therapy will be working on your bed, chair, and toilet transfers to ensure that you are performing these transfers correctly. Your therapist will also be performing exercises with you throughout each treatment. If you had a knee replacement, you will be placed in a recliner chair for a few hours to work on straightening out your knee, striving for 0 degrees extension. Your walker will be fitted for you prior to your discharge home, so be sure to bring in your walker if you already have one. If you don't already have a walker, one will be provided for you before you discharge home. There may be some unexpected pain after joint surgery. For knee replacements, you may have pain in the back of your knee caused by your hamstrings. If you had a slight bend in the knee prior to surgery caused by arthritis, your hamstring tendons were unable to be fully straight. Once the arthritis is removed and replaced with a smooth joint, you may have some discomfort in the hamstrings temporarily as they stretch back out to their original position. Some patients may have upper thigh pain due to a tourniquet that is placed on your upper thigh during surgery to prevent blood loss. For hip replacements, you may have some referred pain down the thigh and even to the knee. Sometimes the knee pain does not show up until after you have discharged home from the hospital. If you've had a direct anterior hip replacement, you may have groin pain that is caused by positioning during surgery, but it will subside over time. Be sure to communicate your pain issues with your surgeon should they arise after being discharged home from the hospital. There are different types of hip replacement approaches your surgeon may use to replace your hip. They are a posterior approach, an anterior lateral approach, or a direct anterior approach. Depending on the type of approach your surgeon uses, your therapist will be reviewing specific hip precautions with you while you're here in the hospital. It is very important to adhere to the hip precautions after surgery. If you do not, it can cause your hip to dislocate. For those of you having a posterior hip replacement, your precautions are as follows. You will no longer be able to cross your legs, bend your hip past 90 degrees, or turn your feet inward for at least 12 weeks. Some examples of these daily tasks that you will not be able to do after surgery include sitting on a low toilet seat, bending to pick up items off the floor, sitting in a recliner chair and then leaning forward to grab items, laying in bed and reaching down to grab your sheets, or crossing your legs or bending down to pin on your shoes. You will need to adhere to these precautions for at least 12 weeks or until your surgeon clears you. For those patients who are having an anterior lateral approach hip replacement, you will no longer be able to do the following. Cross your legs in a figure 4, move your surgical leg backwards, turn your surgical leg and toes outward, and you cannot bend your hip past 90 degrees. Some examples of daily tasks that you will not be able to do after surgery include sitting on a low toilet seat, bending to pick up items off the floor, sitting in a recliner chair and leaning forward, laying in bed and reaching down to grab your sheets, crossing your legs or bending down to put on your shoes. Remember, you will need to adhere to these precautions for at least 12 weeks or until your surgeon clears you. For those patients who are having a direct anterior hip replacement, you will not have any hip precautions. If you've had a knee replacement, it is very important that you do not place anything underneath the knee. Do not place pillows behind the knee at any time. If you have an adjustable bed at home, be sure that the knee portion of your bed is locked out and does not bend. Likewise, in the hospital, we will be locking out your leg portion of your bed to ensure that the knee does not stay in a bent position. As a reminder, getting the knees straight is more important than bending initially. If your knee does not get to 0 degrees extension or straight up and down, you can continue to have a limp, which can cause you to have knee, hip, back, or shoulder issues due to not walking properly. Prior to your discharge home, we will be making sure that you have all necessary medical equipment. All patients who discharge home will need a rolling walker. The rolling walker that you will need is pictured here. Some patients have a rollator, which is a four-wheeled walker with a seat. You will not be able to use this walker initially, as a rollator is primarily used for balance versus taking pressure off of your surgical leg. For those patients who have had a hip replacement, you will benefit from a hip kit to enable you to perform activities of daily living while still keeping to your hip precautions. A hip kit will be provided for you here at the hospital, and the physical therapy staff will review with you how to use your hip kit to allow you to get dressed while abiding by your hip precautions. The day after your surgery is considered post-op day 1. In the morning, your nurse will begin her assessment and pass out morning medications. Your tech will be coming in and getting you cleaned up for the day. You may also change into your clothes at this time if you would like. The nurse will be working closely with therapy to schedule your pain medications prior to your physical therapy treatment. During your therapy treatments, you will be assisted up and walk in the room and halls. As a reminder, your family members are not allowed to walk with you in the hall, and masks must be worn at all times in the presence of a healthcare provider. You may be transferred into a chair, and your physical therapist will be performing exercises with you. You will be working towards those goals set during your evaluation, and if you have met those goals by post-op day 1 and your surgeon and internal medicine says that you're fine, you will be cleared to discharge home. If you're not quite ready for discharge, you will stay with us another night. The nurses will continue to assess you with each change in shift, and by post-op day 2, your drain and on-cue ball will be removed, if you had one. Your home health arrangements will be finalized, and all medical equipment that was ordered will be delivered here to the hospital. You will continue to work with physical therapy 2 times a day until you have met your goals, and until your surgeon and internal medicine physician has cleared you for discharge. A few last words when it comes to physical therapy. Over the next few weeks, you will continue to set goals with your physician and therapist to progress towards improving your strength, range of motion, and return to independence. Remember to maintain a healthy diet and stay compliant with your physical therapy. You are in control of your own progress. A case manager will be meeting with you on either the day of surgery or the morning of post-op day 1. They will be finding out what your needs are for medical equipment, and be sure to order any equipment you may need prior to your discharge home. Case management will be working closely with your insurance company and will be sending clinical information daily, updating your insurance company on your medical necessity. Our typical length of stay is 1 to 2 days in the hospital, with the occasional same-day discharges. If home health has not been set up already by your physician's office, case management will be working with you and your insurance company to find a home health company that is in your area and in network with your insurance. Most patients will discharge home with either home health therapy for 2 weeks or directly to outpatient therapy. If you live alone, it is imperative that you make plans to have someone at home to help take care of you once you discharge home from the hospital. Most insurances, including Medicare, are no longer covering inpatient rehab facilities. The only alternative, if you are unable to discharge home, is a nursing home. The primary goal is to have you discharge home to your own home environment, which will reduce your risk for infection, exposure to COVID, and other illnesses. If you have any questions from this presentation, please contact Julie Davis at 817-837-4633 or through email at juldabis@uspi.com. As the COVID pandemic progresses, all COVID restrictions are subject to change based upon government regulations, CDC guidelines, and hospital policies. Thank you for watching this joint education presentation. We at Baylor Scott & White Medical Center Trophy Club look forward to serving you.